Good morning, everybody. My name is Krista Holloman at the News 10 Plus Digital Desk, and we are going to take you to Lansing, where Governor Gretchen Whitmer and Representative Sarah Anthony are going to be signing a bill that will ensure equal coverage for mental health and substance abuse treatment by insurers. So let's listen in on what they all have to say.
My name is Mary Ann Huff, and I am the President and CEO of the Mental Health Association in Michigan. A lot of people don't know who we are, but we've been around since 1936, and we are the state's oldest non-governmental advocacy organization dedicated to advocating for mental health public policy that positively impacts Michigan citizens with mental health conditions and substance use disorders. And like most people, I ended up as a mental health advocate because I have multiple family members and friends who struggle with mental health conditions. The signage of Michigan's first mental health parity bill into state law is a historic moment for all of our citizens who experience mental health conditions and substance use disorders. For many years, adults and children who found themselves struggling with a mental health condition or substance use disorder have been unable to obtain treatment that would provide much needed relief. It was not until the 1950s that the first psychiatric medications became available, allowing us to move away from long-term institutionalization of individuals with more significant mental illnesses. In 1963, when President Kennedy signed the Mental Health Centers Act into law, we began the lengthy process of moving our neighbors and friends and loved ones with more severe mental illness back to the communities. And the invention of Thorazine, the first antipsychotic, was very helpful. It's been a long road for our Michigan citizens who must live with anxiety, depression, psychosis, and addiction, and other types of mental health conditions. For years, unable to receive equitable treatment, the specter of stigma has influenced the way in which our neighbors, friends, and loved ones have been treated by society. Stigma has negatively influenced the health care that is provided to those who are labeled as mentally ill or addicted. Fortunately, we know that mental health conditions are not caused by immorality or poor genetics, as we used to believe. We know that mental health conditions and substance use disorders originate in the human brain. The federal statute known as the Mental Health Parity and Addiction Equity Act of 2008 is a federal law that prevents group health plans and health insurance issuers that provide mental health or substance use disorder benefits from imposing less favorable benefit limitations on those benefits, medical surgical benefits. What is great about Senate Bill 27, it codifies the protections that are contained in the federal statute and Michigan law, means that mental health and substance use disorder treatment must be provided equitably, as is treatment for physical health conditions. On behalf of the Mental Health Association of Michigan, I wish to extend my thanks to Senator Anthony, Governor Whitmer, all the legislators, and others who worked to make this bill a reality. Thank you.
All right, thank you. And I'm so pleased to be here with both of you, as well as our director, Anita Fox from DIFS. Today I'm going to be signing bipartisan legislation that requires insurance covers treatments for mental health and substance use disorder at the same level of physical health services. I want to thank Senator Sarah Anthony, my senator here, for her leadership to get this bill across the finish line. Right now there are too many loopholes that allow providers to avoid paying for certain medical mental health treatments. They need to close these loopholes, and that's exactly what we are working on here. Senate Bill 27 achieves parity by requiring insurance to cover benefits in substantially the same manner with the same classification as medical and surgical benefits. It also gives us the authority to go after bad actors and raises the issue of substance abuse. As we all know, mental health is just as important as our physical health. The good news is that mental health continues to be destigmatized and people are more open about sharing their challenges and seeking treatment. Watching the way that our young people, my daughter's generation, can speak openly about these issues is liberating and gives me great optimism and inspiration to ensure that our young people can get the support they need, but all people can get the support they need. We've delivered for the first time in Michigan history dedicated mental health dollars for every single public school district. Schools are using these resources to hire counselors, psychologists, and social workers, boosting on-campus mental health for our kids, mental health help for our kids. So while acceptance increases and we can continue taking action through legislation, we've got to pay attention to some very concerning trends. There's no question. In March, we saw the Gallup Global Happiness Report show that for the first time, America was not one of the happiest 20 nations in the world. We fell from 15th to 23rd, largely because of a huge drop in self-reported well-being from people 30 and under. Our own data backs this up. A recent CDC survey of high school students showed that more than half of high school girls and 1 in 3 boys reported feeling persistently sad or hopeless. Rates of depression and anxiety have largely gone up across the board, but especially for our kids. I'm sure every single one of us knows someone who struggles or has faced these challenges ourselves. When it comes to the other issues that we're talking about, last year, we lost more than 107,000 Americans to substance use disorders, including almost 3,000 Michiganders. That is a slight decrease from 2022, which is the highest year on record. So these are serious national issues. And I know that mental health and substance use disorder are tough. Excuse me. My allergies are killing me. I need some water. Sorry. Give me a minute. Sarah, will you finish my sentence? I don't know why you guys, the allergies are killing me this season. It's true. Anyway, this is a serious issue and we're taking action. So, I'm going to sign the bills now and I'm going to get my composure together. Thank you. All right, come on over. I know you can't catch allergies from me, so we're good. Thank you. Sorry. Yes, thank you.
I know there are a number of stakeholders and invited guests. If you all just want to come up and a quick photo, and then we'll be done with ours.
All right. Come on over. Never come back.
No, yeah, we understand. I think we've all been.
Right, what happened to you? Larry, that's what I
Maybe it's get nice and close, please. Get-
I know you.
Wait, if I can have a minute.
Come on in.
right, it seems the governor is experiencing allergies just like the rest of us, taking a couple drinks of water there. We're going to listen in on some of the questions that she's asking or is being asked of her right now.
Allergies is bad?
Yeah.
I'm going from like Claritin to Benadryl, dessert. I'm trying everything. It's killing me. I know, you're Michigan. All right, happy to jump in.
All right, Governor, does this legislation end all that needs to be done, or is there more that needs to be done?
I think there's always more work to be done. We know that mental health is an issue that so many people grapple with. The good news is it's less stigmatized now. We're feeling more free to talk about it. We're taking action to make sure that treatment is more accessible, but there will certainly be more work to do in this space. But I'm grateful that Senator Anthony was able to get this over the finish line, and of course Director Fox will be in charge of making sure that we're ready to move at the state level on this front.
How is this different than the last attempt at this?
Well, this is very simple. It just aligns our federal standards and guidelines, something that it shouldn't have taken this long to do, but it helps our DIFS team and others to actually administer these types of services equitably.
Dr. Fox, same question.
Gives us the authority to now move in as a state and make sure and review all of the plans to make sure they're in compliance. It gives us more tools if there are complaints from constituents that we can address, so we can help bring mental health parity to all Michiganders, and without worrying that it might be eliminated from federal law like we've seen so many other things. We cement in Michigan law the values that we have in Michigan, and that includes that mental health has to be on the same par with our physical and surgical needs.
Governor, did U of M give you any heads up that they're going to clear the encampment on the campus today? And do you have any reaction to that or the protesters showing up at individual regents' houses last week?
You know, we've had ongoing dialogues with the leaders at all of our universities. I can just say that they asked that state police were on in the perimeter, and they were. I think that it's really important to recognize that there are so many people in our Arab American community, our Muslim community, our Palestinian community, and our Jewish community that are hurting. My job here at the state level is to make sure that people are safe, that we protect, of course, recognize that everyone's got a speech right, but we also have to recognize that every person should be able to feel safe in their community. And that means whether you're worshiping at a mosque or a church or a synagogue. So I anticipate we'll continue to have ongoing conversations. I don't know that there's a whole lot more to add at this juncture, but I do think that showing up on doorsteps in the middle of the night is, I think it crosses the line, and I'm hopeful that as this debate continues that we can be protective of people's rights, but also we have a duty to keep people safe.
Folks, I have one last question on mental health.
Oh, not mental health, sorry.
Governor, there's a bill in the House on this topic that I believe would do more than just kind of mirror the federal law, but kind of expand services. There's been complaints by recipients of mental health services that insurers are denying their claims. Are you open, you or Senator Anthony, open to that bill?
Well, as I said, Dave, I think there's always going to be more good work to do here, and certainly I think this is a real step in the right direction to increase access for mental health services for people. But I'll leave it to the legislature or my director to weigh in on whether or not, what the next step might look like.
When it gets to me, I'm a yes. I support the concept of the bills that are laid out in the House. Ultimately, I'm just looking forward to doing as much as we possibly can to fix this crisis. It's still a crisis, right? And I think that even the work that we've done in the budget, led by Governor Whitmer last year, the recommendations that we're negotiating right now, we are uplifting as much as possible to address this crisis. So I think it's Representative Brayback's bill that you're referring to. I am supportive, but ultimately, whether it's through the budget process or through policy, we have to do all of the above.
Do we think that bill will be pushed through before the end of session?
That's not up to me.
Thank you, everybody. That's all the time we have.
Thank you.
All right.
Appreciate
Thanks,
it.
everyone. See you next.
Okay, you heard Senator Sarah Anthony and Governor Gretchen Whitmer speaking about the insurance coverage for mental health and substance abuse treatment. Of course, she being Governor Whitmer, was also asked about about the situation at the University of Michigan earlier today. We have more on that on our website, WILX.com. We will have more on this bill coming up on 90 minutes of news, starting with first at 4. We also want to remind you that we do have a special section on our website called You're Not Alone. It's our mental health series where you can find resources and stories of triumph for anybody experiencing a mental health crisis. We've got great stories of people overcoming what they thought was their lowest of lows. We've got stories about people coming together to create better treatment options. And you can use your phone right now and scan that QR code for some resources. Until then, we are going to take a bit of a break here on the News 10 Plus digital desk, and we are going to be back here at 2 o'clock with another look at your weather, as this is a First Alert Weather Day with Justin Bradford, and we'll check in with our news team to see what they are working on for over 90 minutes of local news that starts with First at 4. Thanks for watching.